Hello, I'm Dr. Donald Jurivich. I'm a professor of geriatrics at the University of North Dakota. This presentation is supported by HRSA and the Geriatric Workforce Enhancement Program. For further information, please consult the website listed on the left-hand side of the slide. This presentation today is about quality improvement in long-term care. So quality improvement, according to Medicare terms, is called QAPI. That refers to quality assurance and performance improvement. The goals for this presentation are to firstly state why quality improvement in long-term care is important, and most importantly, that it's everyone's mission. And then we want to review the 5 elements of QAPI so we can move quality improvement forward. So here's a case report. There's an 85-year-old lady who was found lying in her bathroom after an unwitnessed fall. The director of nursing reviews the incident report and observes that 60% of falls in the facility occur during the night shift. She is wondering what can be done to reduce the number of falls during this time period. A thoughtful CNA steps up and suggests that all residents perhaps should be offered routine toileting assistance prior to their bedtime as a potential intervention. So this lays the groundwork. This case report really lays the groundwork for thinking about this whole process of who's involved with quality improvement and how it gets jump-started. So you might ask, why do quality improvement? And probably at the top of the list is that Medicare requires it. It's also a way to avoid F-tags, which can come with large penalties from state surveyors. But probably more importantly is we want to do quality improvement because it's a shared interest. We all want to do better care or provide better care and help provide a quality life for people who are residing in long-term care. Finally, one of the compelling reasons to do quality improvement is that we all share in its efforts, and it really does build teamwork, as well as retention of staff. You might notice that there's some pictures and reproductions here. These are all from Leonardo da Vinci, so just a nod to the Renaissance man. And in some ways, I view quality improvement as a way to really have a Renaissance movement towards better care for older adults. The 5 elements of QAPI include the design, the governance, data, performance improvement projects, and then finally a systemic analysis and approach. So we'll cover each of those. And so importantly, it's all hands on deck. And so this metaphor is important to realize that we really need to have everybody involved in quality improvement. That involves all stakeholders, so administration, providers, nursing staff, environmental services, food service, laundry, even residents and family members should be all part of the quality improvement process. So there's generally 3 major areas under which quality improvement falls in long-term care. One is just having the best clinical care possible, making sure people are on the right medicines, not too many medicines, avoiding unsafe medicines. We also want to address the quality of life, for the residents as well as for the staff. Is there any social isolation? Are there any issues that need to be addressed? What about staff resiliency? And then finally, we want to talk about projects that can promote resident choice or their autonomy. So under the 5 elements of QAPI, we need to understand who leads quality improvement at the facility and who the team members are. We also want to know what the policies are for the quality improvement, and each facility should have a policy manual that basically lists who and what, where, when, and why quality improvement occurs at the facility. The QAPI process involves training of staff, and so a newly onboarded staff should learn about quality improvement, and if you're an established staff member at a facility, it's really important for all of us to share our ideas about quality improvement. And then finally, it's reasonable to ask for time carve-outs for quality improvement. I know with a lot of the strain of understaffing, that really puts some pressure on time availability, but we need to work towards finding ways to create time that will allow us to do things better. And then finally, we want to get input to the team, the quality improvement team, through staff members, residents, family members, and consultants, such as the consultant pharmacist or the medical director. So data is one of those 5 elements of QAPI. This basically data is collected from a variety of resources, and it's compared to generally to some national metrics. And so I have an example here of a tracking of falls in a facility. So this is the number of falls per bed days in a facility or a hospital. It could be either one. And you can see over time that the falls start to decline over a period of several months. And the question is what is being done to achieve this good effect. So the underpinning of quality improvement are the performance improvement projects. So it's basically a game plan, for how you're going to improve healthcare or services in a setting, and you want to start small. So it may be just one unit, or it may be just a handful of residents that you test your new idea for changes. And the projects themselves, these PIPs, are based on either surveys, observations, or feedback that you might get from family members who say that my mom is sitting in the chair all the time. She's not getting up and around. So there might be a PIP on mobility enhancement for not only that resident, but for others who tend to be highly sedentary. And of course, we know that sitting around is not a good thing. In terms of the other element of quality improvement, or QAPI, is this whole concept of systematic analysis and action plans. And you see here what's called a fishbone, and basically you fill in the blanks with what you and the team think had contributed to the adverse event. So again, taking the falls analogy, you could ask, who were the people involved? Was it the resident? Was it maybe somebody from the family that was maybe being a little too, I don't want to say feisty with getting their loved one up and around, and was not mindful of safety precautions, for example. Equipment, could a wheelchair have broken, or maybe a cane was not at the right height, and so forth. And so that you fill in these plausible, what you think is contributing or had contributed to the fall, and then you assess it as a whole to come up with an action plan. So just to summarize, we want to know QAPI and its action steps by firstly identifying who's at the lead, who are the players, and who's involved. Everybody should be involved, but there should be assignments. Who are the data collectors? Who are the information gatherers? Who are the people that are actually going to implement the quality improvement? There should be a communication plan, so everybody should know what the PIPs are going on previously and currently. So if a state surveyor came into the facility and said, "Tell me about your project improvements," and you'll say, "Oh, we're toileting everybody before they go to bed, and we're trying to reduce falls." That's a total thumbs up for somebody understanding exactly what was going on with the quality improvement. So the other important point is to do self-assessments, have maybe monthly meetings to reflect on what's working and what needs to improve. And then finally, it's important to create a QAPI plan overall that addresses those 3 elements that we talked about. So resident choice, safety concerns, and then providing quality health care. The other action steps that we want to consider is identifying the data collectors and have regular, at least monthly review of the data, if not more frequently. We always want to be thinking of where the gaps and opportunities exist. So we always have to be observant and say, I wonder if we could do something a little bit better than what that just showed us. And then, and really the backbone of quality improvement is creating these PIPs. We'll see later that they're often driven by what's called plan, do, study, act cycles of change. And then just getting in touch with what we call the root of the problem, and that's the root cause analysis. And if you can recall the fishbone, there's other methods, by the way, other than the fishbone for getting at the root of the problem. And then finally, we want to spread change through systematic action. So if you identify a small project and it had good results, then you want to share that and communicate that with everybody so they adopt and use that methodology. So just finally, there's multiple resources. You can look at the CMS website for QAPI at a glance. The Dakota Geriatrics, which has brought you this presentation, has a lot of resources, including this presentation, which has been archived there. And then finally, you can look at the Institute for Healthcare Improvement. It's a wonderful site for a lot of resources and tools for conducting your quality improvement. So thank you for your attention. I really hope this presentation helps motivate you towards thinking about becoming a quality improvement leader, which we all need to do in whatever healthcare setting we work in. Thank you.